Thank you so much. As Dr. Goldstein said, we are so happy to have you all join us today. We love speaking with pet lovers, and we're very happy that you're here. I'm an internal medicine specialist. I was asked to speak today on nutrition, and Dr. Goldstein and Jackie and I decided that, a lot of us, especially in this area, seem to have pets that live a long time, and we thought that it might be nice to speak about nutrition for our pets as they age. And I chose 4 specific diseases that are often, we like to say age is not a disease, but as our pets get older, they do sometimes are more predisposed to getting diseases. So I'm going to speak specifically about a few diseases today that our older pets may suffer from. We're going to talk about arthritis, diabetes, kidney disease, and heart disease. If I talk fast, we can get through all of those. And I'm happy to take questions at the end. This talk was brought to you by my newest internet celebrity inspiration, who is Fiona, the baby hippo that was born a few months ago at the Cincinnati Zoo. And whenever I'm doing a talk, I just like to stop and Google images of Fiona and put them in my talk. So I hope you enjoy her as much as I do. There she is kissing a picture of herself. So I guess the first question to ask about a talk on aging pets is, what is an aging pet? And right away we come to, there's no consensus, exactly what an aging pet is. I think in very general, dogs that are 7 years or above are considered aging, but of course, with dogs, that's very breed specific. The larger the dog, the shorter the lifespan. So in a Bernese Mountain Dog or a Leonberger, 7 might be geriatric. And in a Chihuahua, that might be, less than halfway through their long lives. Usually about 10 years and older in cats is considered to be an aging pet, which makes both of my kitties at home very old indeed. So again, dogs are more affected, their lifespans are more affected by their size and their breed than in cats, which we generally, they have a same life expectancy kind of no matter what their size or breed. In very general, we talk about puppies being birth to 6 months. Adult dogs are probably 6 months to 6 years in a small to medium-sized dog, and maybe 6 months to 5 years in a larger breed dog. A senior dog is considered about 7 to 10 years old if they're small or medium-sized, and probably about 6 to 7 years old in a larger or a giant breed dog. And then our geriatric patients are usually somewhere 11 years or older in a smaller medium breed, and 8 or older in a larger giant breed. And those are very basic. I hope I don't offend anybody by calling their pets geriatric, but that is what we'll focus on in this talk. And for kitty cats, again, kittens are about birth to 6 months, and then we have adult cats that are about 7 months to maybe about 6 years of age. You start getting called mature when you're 7 to 10. Senior when you're 11 to 14, and geriatric when you're 15 plus. And again, both of my kitties at home are in the 15 plus category and are thriving. They've got no health problems at all, which sometimes makes me feel a little bit guilty. Like I feel like they should have some problems because I'm so accessible here, but they are very healthy kitties. So then what about these older pets? What about the diets? There are a lot of senior diets out there or geriatric diets out there, and I myself was just researching it for my own cat, who again is 15. She was looking a little bony. I wanted to switch her to a more calorie-dense diet. And I thought, well, what is a senior diet? And what does that even mean? So if you look at the different senior diets that are out there, there's no universal definition. It's whatever the pet food company decides to put on their label, right? And as we said, age itself is not a disease, but the senior or geriatric diets try to focus on some conditions that tend to occur in a lot of pets as they get older. And a lot of the senior diets seem to focus on weight, keeping the weight down, but I myself have a skinny cat that needs to put some weight on in her senior year. So you just need to read the labels and make sure that the senior diet that you're looking for matches up with your particular pet. A lot of the time, these senior or geriatric diets, as I mentioned, are lower in calories because as we all get older, we are usually a little bit more sedentary and probably don't burn as many calories, and older dogs tend to put on weight. And cats too. And also, gaining weight as you're an older pet can exacerbate things like arthritis or heart disease or certainly diabetes as well. And so we definitely want to keep out all of our pets at the appropriate body condition. Some of these senior diets are lower in protein, but I feel that that's fairly controversial. I don't think there's any reason to restrict protein, especially in cats who are carnivores, unless your pet has a disease that specifically requires a protein restriction. For example, a liver dysfunction or a chronic kidney disease would be two examples. But certainly, look at the labels again. If your senior diet touts that it's good for aging pets because it's lower in protein, I don't think that that's necessary for all pets. A lot of the senior diets have things like glucosamine and chondroitin, and those are medications, and they are medications, nutraceuticals that are good for bone and cartilage health. We'll talk about that in just a moment. And I'm a fan. I don't see any downsides to having those added to the senior diet. So I think most of the senior diets that you'll find will have those as one of the reasons that they are for aging pets. But do be careful, because some senior diets have certain dietary restrictions or dietary additions that your particular aging pet may not need. So for example, some of the senior diets are phosphorus restricted, but there's absolutely no evidence that a pet needs phosphorus restriction simply because their age is a certain number. True, animals with kidney disease need phosphorus restriction, but other pets do not. So do be careful with that. Sometimes they're protein restricted, sometimes they're sodium restricted. Maybe that's helpful if your pet has heart disease, but not every aging pet needs sodium restriction. And as we said, a lot of the senior diets and geriatric diets are calorie restricted. So if your pet does not need to lose weight, then they do not need a calorie restricted diet. A lot of the diets have additions such as fiber. Fiber is one of the things that helps make a diet calorie restricted. Fiber fills you up and it doesn't have a lot of calories. But if your pet has firm stool, the fiber is only going to make it firmer. So again, think about it in relation to your particular pet. And there are also potentially a lot of supplements in some of the senior diets, and so you should definitely talk to your veterinarian or do some research about whether all of those supplements are right for your pet. So, in general, does your pet need a senior diet? Well, I think that if your pet is, no matter what their age is, if they are healthy, if they are in good body weight and have a nice muscle mass as well, so it's not just about the number on the scale, but it's also about how does their muscle mass look, how does their coat look, is it nice and shiny, do they move around, are they active, are they on a high quality nutritionally balanced diet? If all of those are true, then your pet probably doesn't need to switch to a senior diet simply because their age has reached a certain number. Fiona, to make us all smile. So we're going to talk a little bit about some diseases that often occur as our pets age. And again, age itself is not a disease, but the longer we're on this earth, the more prone we are to developing certain problems. So we're going to talk about arthritis first. And arthritis is wear and tear on the joints. So joints are where two bones meet together. So, we've got our elbow joints and our knees and our ankles and things like that. Joints are connected by ligaments, so the two bones are connected by ligaments. And they're covered in cartilage, and the cartilage acts as a cushion. So the cartilage acts as a cushion to take in any of the momentum from walking and running and jumping and thinking. The shock absorber is the term I'm thinking of. There is a capsule covering the joint, and then inside of the joints where the cartilages meet is joint fluid. And the joint fluid, again, lubricates and helps to absorb any shock, helps reduce wear and tear on the cartilage. The joint fluid also it provides nutrients and white blood cells, so it's a fluid in which nutrients and white blood cells can be delivered to help with any inflammation and keep the joint healthy. So joints, all of our joints, as I stand here, my hip hurts, my knee hurts, all of our joints have problems as we age. And joints can be damaged from many different things. Most commonly, our joints are damaged from just wear and tear. You've got your active dogs that, could run 5 miles when they were younger. That's going to cause wear and tear. Or your cat that used to be able to jump from the floor straight to the top of the refrigerator. Those joints get wear and tear on them. Poor conformation also, and unfortunately we breed for this, and I'm guilty. I kiss every French bulldog and bulldog that walks through the door, and I think they're so cute, but they were born, dachshund as well, but they were born to have short, squat little legs, and they get a lot of wear and tear on their joints. But they're so cute. For repetitive or prolonged strain, so especially our athletic animals, I see a lot of guide dogs here today, and they, with many of you, they do a lot of walking, a lot of repetitive motion, a lot of stairs, things like that. We see a lot of police dogs here. They're on the beat, they're walking, they're walking back and forth, doing their jobs as well. So, all of our joints, the more active we are, the more wear and tear they get. Obesity can just increase the amount of weight that is acting on a joint, so it's more pressure on the joint and more force on the joint. Prolonged confinement, which hopefully none of our pets are in, but we all know that there are animals out there that are in crates, that are in shelters, that don't get to move around as much as they should, and that can be damaging to the joints. And then, certain times there are health problems like joint infections and immune-mediated joint disease, which is not very common, but perhaps somebody in here has had a pet with that problem. We see it a reasonable amount. And when you've got that inflammation, infection, wear and tear, etc., you get less joint fluid as a result, and you get cartilage damage as a result. And that's essentially the origin of arthritis. And arthritic dogs, so we're going to talk a little bit about dogs with arthritis, and then we'll focus on cats with arthritis. I believe arthritis is more easy to pick up in dogs than it is in cats, because I think we see our dogs walk more, and I don't know, maybe our cats hide their pain a little bit more, so we're going to focus on them separately. So dogs with arthritis can have very mild signs to very severe signs, and I think the classic sign of arthritis, mild arthritis or moderate arthritis in a dog is, they're just so stiff when they get up. So they're stiff, and then as they start walking, they tend to loosen up a bit and they look a little better. But arthritis can be quite severe, and sometimes we see animals that have arthritis that's so severe that it's hard for them to even get up. So it can have a wide range of signs. Arthritic dogs will often gain weight because they can't get up as comfortably and do their exercise. And they will also have joint swelling as well. Our goal, how can we use nutrition to help dogs with arthritis? Our goals are to get them to be a great weight. So usually with arthritic dogs, that means weight loss, but only if that makes sense for that particular dog. And probably weight loss and making the dog's weight an optimal weight is going to be the number one thing that we can do to help the quality of lives with arthritis dogs. So optimize weight, optimize muscle mass. A lot of that is done through diet and through exercise. And then also you can change your environment for dogs with arthritis. You can offer soft padded bedding. You can offer ramps or steps to get up to the bed, or the things that they used to be able to jump up onto. And a lot of arthritic dogs have real trouble with slippery floors, hardwood floors like are in many of our homes. So carpets, runners, yoga mats. I certainly have plenty of clients that have just yoga mats all over the house, from the kitchen to the water bowl to the door, there's a pathway. And that is very, very helpful for these arthritic dogs. In terms of ingredients to look for diets for arthritic dogs, we are going to be looking for things that are low in fat and oftentimes high in fiber, because again, fiber is something that is often in weight loss diets. We want to make sure that these dogs have adequate protein, because we don't want to protein restrict them, we want them to build muscle. So we want to make sure that they get plenty of protein in their diet. And then omega-3 fatty acids, you're going to see that as a constant. I think every single disease I have up here says, omega-3 fatty acids are really good for this disease. They help reduce inflammation. They're also great for joints. They're great for coats. They increase palatability of food, so omega-3s certainly. And then those ingredients like glucosamine and chondroitin are often in dog foods, and senior dog foods are also very good. So arthritic cats may present a little bit differently, because I think cats hide their pain better, and we don't expect our cats to go outside with us and play fetch, and we don't know that they don't jump around necessarily as much as they used to. So a lot of times arthritis in cats may present more as a very subtle, very slow slowing down. I thought they were just getting older, and that's why they weren't jumping as much. Some signs of pain in cats may be different than what you may think. They may have inappropriate inappropriate elimination. So they may avoid the litter box because it hurts to climb up inside the litter box and position themselves. So that might be a sign of arthritis in a cat, especially if you've got a high-sided litter box. They may not groom as much, so that may be something that you notice. It might just hurt to turn back and groom over the tail head or things like that. They may not like to be brushed as much as they used to, for those of us who brush our kitties. And then, of course, the more common signs, like they may not want to jump up as high or jump down off the bed or things like that. They may sleep more, they may move less, and they may hide or have less interaction with you because they hurt. So cats can show pain in different ways, and we need to be, as cat owners, we need to be alert and aware of those signs. Cats with arthritis can also gain weight because they're not moving as much as they used to, and they also may have joint swelling, although I think that's fairly common in cats with arthritis. So how can we use nutrition to improve the lives of our kitties with arthritis? Same thing. I think it really focuses on usually losing weight or at least optimizing their weight so they don't have to carry around this heavy load on their aching joints. You can also try to optimize your kitty's environment. So again, soft padded bedding. A lot of cats, heat may be soothing to them, so maybe a heating pad that they can sleep on when you're home. Ramps and steps, and maybe using a low-sided litter box for these cats that are having trouble getting into the box. And again, weight management. So try to optimize body weight, optimize muscle condition score. And what ingredients are we going to look for in our foods for cats with arthritis? Again, low-fat, high-fiber foods if we think that they need to lose weight. Make sure they've got plenty of protein because cats are carnivores, they need protein, and we also want them to build muscle mass. And omega-3 fatty acids, glucosamine, chondroitin are all very appropriate supplements to put in the diet of cats with arthritis. Okay, and then in terms of treats for pets with arthritis, why not use a treat that has the ingredients to help with joint health? A lot of these products exist. I was just on Chewy.com and I Googled arthritis, or I searched arthritis there, and there were so many options, so many different treats with omega-3 fatty acids, glucosamine, chondroitin, all of these different things for joint health. So treats, make them work for your pet's health. There are plenty out there. I know that our orthopedic service really likes Dasaquin Advanced for cats and dogs with arthritis. Okay, little Fiona giving us, I don't know if that's a smile, a yawn, or wanting her bottle. All right, moving on to diabetes, my personal favorite topic. So dogs, we're going to talk about dogs with diabetes. Dogs get type 1 diabetes, which means that their pancreas fails to produce adequate insulin. And so they are always going to need insulin injections with dogs with diabetes. Maybe sometimes we can get away with some oral medications. Diabetic dogs are often overweight. But if they're not treated, or if they're not treated adequately, diabetic dogs can lose a ton of weight and lose a ton of muscle mass as the disease progresses. So when diabetic dogs come to me, they could be anywhere in the spectrum of very fat to quite thin. Diabetic dogs, the way that we can use nutrition to help with diabetes is we have to be very consistent with their diet. As long as a diabetic dog is on a wholesome, good quality diet with some added fiber, I don't usually switch their diet, but I do like them to be on a very consistent diet, the same amount and the same type of food at the same times every day. And if you're going to give a treat, give the same kind of treat at the same time every day. And if you're going to exercise, do the same amount of exercise at around the same time every day. So diabetic dogs need consistency. Diabetic dogs, like diabetic people, will have a spike in blood sugar after they eat. And so we recommend giving a meal when you're giving insulin, so every 12 hours, twice a day, because they need the insulin on board to smooth out that spike in blood sugar. And that's why we don't recommend giving them a huge meal in the middle of the day if you can avoid it, because they will have a spike in blood sugar and may not feel very good after that. Our goals with diabetic dogs, again, as I said, they might be really fat, they might be really thin, so we just want to optimize their weight and make sure that they're in great great shape and have great muscle mass. And we also want to reduce any postprandial or after meal spikes in blood sugar. And that's where fiber comes in. I do like fiber in my diabetic dogs. They should be on a wholesome diet, period, plenty of protein, etc. But what fiber does is two things. The first thing is that it's a complex carbohydrate, so it breaks down, it itself breaks down slowly, and so helps avoid that spike in blood sugar. The other thing fiber does is it slows the movement of food through the GI tract, so it slows transit time. It stays in the stomach a little longer, then the intestines a little longer, so your body digests it more slowly, and again, that helps even out the spikes in blood sugar. So I like fiber in my diabetic dogs. So ingredients for a diet in diabetic dogs, again, I don't usually change their diet as long as they're on a high quality, nutritious diet, but I will add some fiber if I don't think that that diet has a lot of fiber. We need to increase fiber, but be aware, fiber also causes weight loss because it bulks you up, it makes you feel full without adding a lot of calories. So if you're one of those diabetic dogs that is thin, that's had uncontrolled diabetes, I don't want you on a high fiber diet. I want to get you in, give you lots of protein and maybe feed you, small frequent meals, get you bulked up, and then consider adding fiber. Low carb and low glycemic index carbs, so you don't want ingredients in the diet that are going to burn very quickly and cause a spike in blood sugar, just like people. We want them usually to be low fat if you've got a diabetic dog that's overweight, and you want to have very high quality meats and fish, high quality proteins in your diet, always. Fiona is yawning. Okay, so diabetic cats are a little bit different. Diabetic cats tend to get type 2 diabetes, which means that they are insulin resistant. So their pancreas makes insulin, but their cells can't use it. Their cells are resistant to insulin. And one of the number one predisposing factors to insulin resistance is obesity. So our fat cats become diabetic. Just like in dogs, as the disease progresses and as cats' blood sugar stays high for a while, their pancreas can actually produce less and less insulin. So they start out as insulin resistant, and ultimately they do progress to actually needing insulin. Sorry about that. Diabetic cats tend to need twice daily insulin injections. They also need a high protein diet. We don't want these cats getting any carbs at all. Cats don't need carbs, and we don't want diabetic cats to get carbs. We want them to get proteins and fats. And we want them to be on a stable diet and a stable exercise plan. Cats don't tend to get that postprandial spike in blood sugar like dogs and people do, but I still think it's nice to at least give them a little bit of food twice a day around the time of the insulin, just so that you see them eating and you're 100% sure. I know some of my clients have one diabetic cat in a household of 5 cats, and if they've just got food out all the time, they never totally know that the diabetic cat is eating, and we don't want to give insulin if the cat is not eating. So I still, even though cats technically don't need to be meal fed with diabetes because they don't have that spike in blood sugar, I like to give them a little bit of wet food with their insulin at least twice a day because I want to be 100% sure that that cat is healthy and well. And in multi-cat households, that can be difficult. So our goals for diabetic cats is that we often want them to lose weight, but we don't want them to lose muscle mass. We want them to be nice and muscular, so lots of proteins. Cats, we talked about, they don't tend to get this spike in blood sugar like dogs and people do. Who knows why, but that's just how their bodies are. So it's fine to, sometimes I'll have a diabetic cat and they are just so used to having food out all the time. They're grazers. They'll eat a little bit here and a little bit a few hours later and a little bit in the middle of the night. That's fine with me, as long as you know they're eating, and I still think it's good for them to get some canned food at least twice a day. Cats are particular, so again, if they're used to their free choice feeding, I don't necessarily take away their free choice food. I want them to be happy diabetic cats, not frustrated diabetic cats. So our ingredients for diets for diabetic cats, we really want to focus on protein. We don't want them to get carbohydrates. And we want them to have a moderate or low fat, depending on how much weight your cat needs to lose. We want them to have high quality diets, and most of my diabetics do very well on at least some canned food. Again, sometimes it's hard to break that dry food habit in cats, and that's okay, but I like them to get at least a little bit of canned food. What about treats for diabetic cats? Now this is for dogs or for cats with diabetes. Good treats are going to be protein treats, so a little bit of meat, a little bit of fish, especially for cats, but also for dogs. We want to stay away from carbohydrates, especially carbs that have that low glycemic index that break up very easily and cause a spike in blood sugar. We always want our treats to be less than 10% of our daily calories, and I think diabetic animals should probably a good time to get a treat is maybe midday. And maybe after exercise is a good time to give a treat to a diabetic pet. But again, we want the routine to be very, very stable. We want them to get the same number of calories of treats around the same time every day. What about enhancing palatability for diabetic cats? So, we can make all of these fancy prescription diets, and we can put cats on these special high protein, low carb diets for diabetes, and what if they don't like them? So what are some ways you can enhance palatability? Diabetic animals usually eat well because their bodies are, even if their blood sugar is high, their body can't use the sugar, so they think that they're hungry all the time. So if your diabetic pet is not eating, you probably should see a vet because they might actually be sick because usually they eat pretty well. It's also the reason a diabetic pet that isn't eating well should probably see a vet is because it is very hard to guess how much insulin they're going to need if they're not eating. So it's probably a good time to stop by your veterinarian, at least for a quick checkup and a blood sugar, and to find out if it's okay to give your pet insulin that day. Here's Fiona and her mommy swimming in their tank. So cute. All right, we're going to move on to kidney disease. Kidney disease in dogs and cats, most of my recommendations are going to be fairly similar between dogs and cats, but because the rest of the talk was organized by dog and by cat, I kept that same theme. So we're going to talk about dogs with chronic kidney disease. Now, chronic kidney disease is diagnosed by high kidney values in the blood. And for any of you who are unfortunate enough to know this information already, our kidney values in the bloodstream are creatinine, and then also SDMA and BUN. But we also look at lots of other things. We look at the blood protein albumin. We look at the mineral phosphorus, which often becomes elevated as our pets progress with their kidney disease. We look at potassium, which sometimes is high and sometimes is low in pets with chronic kidney disease, and we need to know which of those this particular pet has. We look at red blood cell count because cats can develop a low red blood cell count or anemia as kidney disease progresses. We check blood pressure because animals can become hypertensive, have high blood pressure as kidney disease progresses. And we also look in the urine, make sure there's no infections, see how concentrated or how watery, how dilute the urine is. So even though we all talk about kidney values and we talk about creatinine most of the time, there are a lot of things that we look at when we're trying to assess the health of a pet with kidney disease. Kidney disease is staged by your veterinarian using the simple value of creatinine. And I just wanted to show you that we stage kidney disease we stage it into 4 stages. Stage 1 is that their creatinine is actually normal, but we have some reason to worry about those pets' kidneys. Maybe the urine is dilute, maybe the creatinine is normal, but the SDMA is elevated. Maybe we saw something on ultrasound and we know that they've got 2 very small kidneys or a tumor on the kidney or kidney stones or something. So they actually have a normal creatinine, but we want to keep an eye on that pet's kidney values for some reason. Stage 2, again, is based on creatinine. In dogs, it's a creatinine of 1.4 to 2, and that's called mild kidney disease, and most pets will not have any clinical signs of kidney disease in this mild stage, but we do recommend switching the diet even at that early stage, and we'll talk about what we recommend for those pets. Stage 3 is a creatinine of 2.1 to 5, so that's a really, really wide range. If you've got a creatinine in the lower end of that range, you're probably going to feel totally fine. If you've got a creatinine in the higher end of that range, you're going to be feeling pretty sick. So stage 3, which is called moderate kidney disease, it has a wide range of how pets are feeling in there. And then stage 4 is a creatinine of greater than 5, and those pets will be sick. They will not be eating well. They will often be vomiting and losing weight. So kidney disease in dogs is diagnosed and staged by the creatinine, and stage 1 is mild, stage 2 is moderate, stage 3 is severe kidney disease. And for all of those stages, what are our goals? How can nutrition help us for our dogs with chronic kidney disease? We often want to maintain weight, or as pets develop, as their kidney disease worsens, they will often lose weight. So sometimes with chronic kidney disease, we actually want them to gain weight and muscle mass. We want to improve appetite, because one of the hallmarks of kidney disease is having a poor appetite or a finicky appetite, so that is something that we really need to work on and get our pets eating well. A lot of our patients with kidney disease are dehydrated, so we really emphasize canned diets where we can, adding water to the diet, a lot of different ways to try to get them to drink more. You guys have probably heard, fountains for cats with chronic kidney disease, or some dogs like to play with ice cubes and that'll get them to drink more water, those sorts of things. We want to avoid phosphorus in the food. That's the hallmark of a kidney diet, is that it's low in phosphorus. And if the phosphorus is high in your pet's bloodstream and they're already on a kidney diet, a low phosphorus diet, we will treat that. We will give a medication to artificially lower the phosphorus. It's dangerous. And ultimately, we want our diet to prolong the time before our pet feels sick from their kidney disease. And that's why we recommend starting the kidney diets all the way in stage 2 in mild kidney disease, when your pet doesn't even feel sick, because we don't want to try to introduce a new food when they're in stage 3 or stage 4 and they're already very sick and picky and they don't want a diet change. So that's why the recommendation is out there to start the kidney-specific diets all the way in stage 2, when they might not have they might not be sick from their kidney disease for years and years. It has to do with palatability, and that's a better time to change the diet and get a new diet accepted. So ingredients in our kidney-specific diets for pets are going to be low phosphorus, is the hallmark of a kidney-specific diet. They're a little bit protein restricted, but I have a lot of clients who come in and say, I need a low protein diet for my pet because it has kidney disease. We love protein. Your pet needs protein to grow muscle and be healthy. It's just that protein has a lot of phosphorus in it, so it's impossible to make a phosphorus-restricted diet without dialing down on the protein a little bit. But I certainly have some cats that are in, let's say, stage 4 kidney disease, and they're muscle wasted as can be, and I give them high protein diets, because you have to look at everything, and if you have a pet that needs muscle mass, you can't protein restrict them. But that's where the protein restriction in kidney disease comes from. It's actually, we're just trying to restrict the phosphorus, and we have to restrict the protein a little bit to do that. So they're moderately restricted in protein, and they have very high quality proteins. They are often moderate in sodium. There's not a lot of evidence that ingesting salt leads to high blood pressure in pets like it does in people, but we figure, okay, why not restrict the sodium a little bit, because we worry about high blood pressure in these pets. And of course, our omega-3 fatty acids, which enhance palatability and are thought to reduce any inflammation in the kidneys. And we really recommend a canned diet for these pets, and we do recommend adding water to the diet, especially as the disease progresses and your pet is more prone to drinking less, not feeling well, vomiting, losing fluids. And there's Fiona in her bathtub looking adorable. So kidney disease in cats is fairly similar to kidney disease in dogs. It's again diagnosed in exactly the same way. It is staged by creatinine, and the staging system is the same in dogs and cats, but the numbers are a little bit different. In other words, we allow a slightly higher creatinine in cats than we do in dogs. So for cats, creatinine, stage 1 is when their creatinine is less than 1.6, but we have some reason to worry about that pet's kidneys. The creatinine's fine, but we want to keep an eye on that pet's kidneys. Stage 2 is 1.6 to 2.8, and so that's considered mild disease. A cat is not going to have clinical signs of kidney disease in that stage. Stage 3 for cats is a creatinine of 2.9 to 5. So again, at the 2.9 or 3 stage, you might not have any clinical signs. By the time your creatinine is 4 or 4.5, you're probably going to start to have some clinical signs. And then a creatinine of greater than 5 is considered severe kidney disease, same in dogs and cats, and you will have clinical signs at that stage. So by stage 3, moderate disease, you're going to start seeing signs. The signs of kidney disease are often gastrointestinal in origin. They'll vomit, they'll have diarrhea, they'll have a picky appetite or reduced appetite, and they'll often lose weight and lose muscle mass. So our goal, what can we ask of our diet when we have a cat with chronic kidney disease? Our goals are to maintain or gain weight, because as kidney disease progresses, patients lose weight and lose muscle mass. We want to improve appetite. Cats especially get so picky when they have kidney disease. I have so many clients that say, oh, I was on this diet, and then after a week she stopped eating it, and now we changed to this diet, and now we changed to this diet. So it can be really tough. They get very picky, and that's a sign of inappetence. It's a sign of not feeling well from your kidney disease. We want to improve kidney function. We want to lower phosphorus. We want to make the pet very hydrated. We want to avoid or treat high phosphorus and prolong the time until they're sick from kidney disease. And there have been numerous studies that show that a phosphorus-restricted, kidney-specific diet improves kidney health and prolongs the time until a pet feels sick from kidney disease. So 100% nutrition is a cornerstone of therapy for chronic kidney disease. When we're looking for ingredients for our cats with chronic kidney disease, we're looking for low phosphorus, moderate high quality protein, and again, cats need protein. They are carnivores, so the only reason we're restricting protein is that we are trying to restrict phosphorus, moderate sodium and omega-3 fatty acids. In terms of treats for pets with chronic kidney disease, we want to avoid high phosphorus, so avoid liver, avoid other organ meats. I think liver is the most common organ meat in snacks, but certainly, avoid heart and things like that. Avoid shellfish, they are high in phosphorus, and most dairy products are very high in phosphorus. Cream cheese is okay, but most other cheeses are high in phosphorus, so avoid those as treats. Avoid high protein, although to be honest, if your cat wants a little piece of fish, I think that's okay. Fish is not high in phosphorus, it's more the shellfish that is. Try carbohydrates and fruits for dogs. A lot of dogs love blueberries or a piece of bagel or things like that, so those are very low phosphorus treats. Most cats will prefer a little bit of fish or a little bit of meat, and yes, I know they have protein in them, but again, we're always keeping our treats to less than 10% of your pet's daily calories. In terms of enhancing palatability for cats with kidney and dogs with kidney disease, it's really important because these pets really will lose their appetite as their disease progresses. So try adding small amounts of cooked fish or meat on top of the food or mixed in with the food. Try carbohydrates. The nutritionist that I used to work with in my residency would always say dogs with chronic kidney disease want vanilla or fruit flavors. We'd all sit there with our warmed up, meat and meat, baby food and things like that. Vanilla wafers, fruit flavored yogurt. I'll stop at Dunkin' Donuts and get corn muffins and blueberry muffins if I've got a patient in the hospital that doesn't want to eat from chronic kidney disease. If a kidney disease pet is not eating or is eating very little, do see a veterinarian because your pet might need fluid therapy. They may be constipated because as they get dehydrated, they suck water out of their stool and they may not want to eat because they're full of stool. And then sometimes we will place feeding tubes in these patients. If mom or dad wants more time with the pet and the pet is doing okay except that it's not eating enough, we'll place a little tube in the side of the neck and you can give food and water and medications through it. So I think I'm almost out of time, so maybe I'll just very quickly go through, there's Fiona staring at you, heart disease in dogs and cats. And basically what I want to say is that there has been some new research that shows that proper nutrition may actually slow the progression of heart disease and may actually minimize the number of medications that your pet with heart disease needs. And who wants to give their pet medications, so that's hard to do. So that's wonderful. So for heart disease in dogs and in cats, we want to optimize their body weight, and of course that's the theme throughout this whole talk, right? Use nutrition to help your pet be the optimal body weight and muscle condition. And we want a high quality, nutritionally balanced diet with adequate protein and calories because oftentimes animals, when they're diagnosed with heart disease, may be obese, but as the heart disease progresses, they may lose weight and lose muscle mass, mainly because they don't feel well and they're not eating adequately. We want to avoid diets that are high in sodium, probably with any pet that's in heart disease, but definitely if your pet is in or has been in heart failure, we want to do low sodium. In dogs, taurine is not an essential amino acid in dogs. It is an essential amino acid in cats, but there are some dog breeds that seem to get heart disease if they're on a diet that's particularly low in taurine, especially a lamb-based diet. So that's something to think about if your pet is on a lamb-based diet. You should talk to your vet and just say, oh, is it one of the breeds that is predisposed to getting heart disease because of a low taurine diet? And of course, omega-3 fatty acids for dogs and cats with chronic kidney disease. And in my explorations, I did find a really nice website. It's vet.tufts.edu /HeartSmart, or you can just Google Tufts Vets HeartSmart. And they have a lovely website with lots of different foods and sodium counts and all of this great information. They've got 3 veterinary nutritionists working there, and they have a lot of good information on that website, but especially the HeartSmart website. So if you've got a pet with heart disease, I definitely would check it out. I just found it it's new, and I just found it when I was researching this talk. All right, excellent. So I think we are all done, and I think we're gonna stop recording now. Oh, we're gonna video the questions as well? Okay, so I'm happy to take questions, and I think that I'm going to turn the mic on. You have it already. Okay, great. So who is going to, you're in charge of handing the mic? Why don't you just pick anybody? I'm available, like even if the talk is over, I can stay around and answer all your questions. Yes?
Could you please touch on how to help a cat or a dog that has a blood sugar drop?
Sure. If you have a diabetic pet and it has received either a relative or an absolute overdose of insulin. Relative means your pet's insulin needs have changed, which happens all the time, or at least I feel like I see it all the time. And so you're giving the right dose, but it turns out that right now it's too much for your pet. Or if they've gotten an absolute insulin overdose, you gave the insulin in the morning, you forgot to check it off on the sheet, and your husband gave the insulin when he woke up. That's an absolute insulin overdose. So if your pet is having signs of low blood sugar, the signs are they may be weak, they may be wobbly, they may have a starry-eyed look, they may collapse. Everybody in the house with a diabetic pet needs to know the signs of low blood sugar, needs to know where you keep the Caro syrup or the maple syrup or whatever it is, whatever sugary substance you have. You want to take some of that sugary substance, rub it directly on the gums. It doesn't need to be swallowed because it's going to go right into the bloodstream through the capillaries on the gums. Then you're going to try to feed your pet a meal, and then you're going to go to the vet and get the blood sugar checked and see if they need intravenous dextrose. In a household with a diabetic pet, everyone needs to know the signs, and everyone needs to know where the Caro syrup is. Excellent.
Thank you.
Okay.
I have a 9-year-old Maltipoo. She has intervertebrate disc disease.
Mm-hmm.
And I do the laser treatment,
Mm-hmm.
so now I'm down to once a month.
Great.
Is there any efficacy for the glucosamine and chondroitin for that particular, or is it just for arthritis?
No, I think absolutely. So all of your vertebrae are joints also, and they're going to get, that's, absolutely there. You can get arthritis in your vertebral column as well. So I definitely think glucosamine and chondroitin, for sure. We'll get to everybody, I promise.
I have a number of questions, but my dog had cancer, and he's now cancer-free. He had his leg amputated, so now he's a tripaw. But he's 11 years old, and I was wondering if you could address any kind of diet for a dog that was post-cancer.
Sure. An oncologist would have more specific information on that because I do know that there are cancer diets out there, but I'm not 100% sure how they differ. I would imagine that the same thing, focusing on keeping him lean because we don't, he's only got 3 legs left, and so we don't want to put excess weight and excess pressure on those joints. And there may be specific nutrients that are thought to be beneficial, vitamin E or selenium or something like that. I'm not 100% sure. There are cancer diets out there, and I'm not sure. I don't tend to treat those patients. So I'm not 100% sure how they differ from regular diets. Did you see an oncologist for it?
Yes, I did.
Yeah. So, and did they say anything about it?
Not really.
Not really. So I would just focus on high quality nutrition and plenty of protein, making sure not to be overweight and making sure to keep good muscle mass on the remaining legs.
Yeah, and also I went to the other listener about the massage.
Mm-hmm.
She was saying that she didn't really agree with the glucosamine. She liked turmeric
Yeah.
products.
Yeah.
And she kind of said that those supplements were better.
Yeah, I use it myself. The turmeric is anti-inflammatory. So, you ask 10 vets, you're going to get 10 different answers. But it's not wrong to use both. That's perfectly fine.
And also one more question about using, when you're saying omegas, if your dog likes fresh salmon and things like that, is that a good instead of using a
Yeah,
supplement?
absolutely.
Okay, thank you.
Yeah, thank you.
Do you believe it's possible, if you manage phosphorus levels very carefully in selecting your protein, that you could feed a high protein diet to a kidney dog or cat?
I think that cats with the end of stage 3 and stage 4 chronic kidney disease probably need a higher protein diet.
For the dogs, for those of us who might feed raw or
Mhm,
home cooked,
mhm.
I know we try to really, it gets down to spreadsheets and
Oh,
whatever
for sure, absolutely.
phosphorus.
I've myself done research for clients of, there are certain meats that are higher in phosphorus, certain meats that are low in phosphorus. Absolutely, yeah. I don't think you're ever going to be able to phosphorus restrict as much as those cans of Hill's KD. But yeah, absolutely.
The protein quality is better when you
Much
eat it
better.
yourself.
Much better. Yes, I totally agree with that. And the truth of the matter is, it's very easy to find out if it's working because you just have a blood test done. Is the phosphorus elevated? If it's not, then you're doing fine. It's not a mystery, so you can easily have it checked.
And then at what point do you suggest phosphorus binders?
Phosphorus, sure. Phosphorus binders are only for when the phosphorus is elevated and you've done everything you can to get your pet on a phosphorus reduced diet. So either they're on a phosphorus reduced diet or they won't eat a phosphorus reduced diet, and there's nothing more that you can do with diet to lower the phosphorus once the phosphorus is high. We tend to allow a higher phosphorus when they're in stage 4. You're really not going to get the phosphorus below 6. If they're in stage 2, they probably won't have high phosphorus. If they're stage 3, we kind of try to get the phosphorus around 4.5 or 5. Yeah.
Hi. You mentioned high quality protein in a lot of the recommendations. Is that what is your definition of high quality? Is it the source, or is
It's the source and the it's not like chicken versus fish. It's more how it's processed. Did it come from a good source? Things like that.
so there's not a particular source of protein that you would recommend as being higher quality in terms of like beef or fish? Or
No,
lamb?
not necessarily. I find that many pets are particular about it. So I'll have
more of a
cats that hate
preference.
pork and cats that won't, love fish but won't eat chicken, those sorts of things. I had a client just yesterday, we were talking about novel protein diets for food allergy, and she said, oh, my cats won't eat venison. Wow, okay. So I think that, it's not, it has to do with really more the company
I
and
see.
how they're handling the
And
protein.
so you see also grain-free. So
Mhm.
in an otherwise healthy pet, is there any value to have grain-free and
So
more
it-
higher in protein?
It's a great question. I think the grain-free specifically, I think most veterinarians think is a bit bogus. I think it's a little bit like, especially the gluten-free stuff. I think that it was popular in human medicine and it became a catchphrase and it sells well. That said, I do believe that the fewer, grains are carbs, obviously, and the fewer grains, most likely the more protein. And so I do think that there's some truth to, cats don't need grains in their diets. And so, sure, a cat can eat a grain-free diet. I think that's wonderful. Cats really only need meat and fat in their diets. But I don't, I have a lot of clients that say, well, of course we feed grain-free and for their dog. And, okay, that's fine if you want to do it, but I think you're probably paying more for maybe ingredients that you don't need.
I have kind of a similar question. You mentioned low glycemic index carbs. I can think of sweet potato. Is
Yeah,
there- what
if
would
you
be another
Google
one?
it, you can find so many lists for people, and it's exactly the same for dogs. It's too much of a list for me to memorize because they don't always make sense to me. Like a strawberry will be, but a grape won't be. So not that you should feed grapes to your dogs, obviously. But so I just Google it. if I have a client who has a pet that wants to feed carbohydrates and they're diabetic, we just Google low glycemic index.
Okay, and for cats,
Mhm.
do you think that there is indeed a protein level that's actually too high to be feeding them?
No, I don't think I've come across that data. Yeah.
Thank you. Every one of the cats that I've had over the years has all reached a certain age where they become overactive thyroid.
Uh-huh.
Is there anything I can do? Because I have 2 cats now, they are not affected thus far. But is there anything that you can do to just prevent this from happening?
We don't know the answer to that. I wouldn't be surprised if someday we did find out that it's, the aluminum from the cans or something like that. But we don't know right now the answer to that. There is a diet called Hill's YD that is severely iodine restricted and is thought to be a diet that can treat feline hyperthyroidism, as opposed to giving
once they get it.
once they get it, but not to prevent it. It's absolutely not safe for a cat that doesn't have hyperthyroidism. So, and I was just reviewing some of the thyroid literature for a different talk I was giving, and I just haven't found anything.
So
But I think it's
frustrating.
one of the things that we just don't know yet. There's so much that we just don't know.
And the last question, I've had 2 tuxedo cats, both have been diabetic. My boy, he was wonderful because every morning we'd go in the bathroom and he would actually pee in a cup and I could measure his levels. He was amazing.
That's a good cat.
Truly amazing. And his levels went down to the point where I stopped giving him insulin.
Mm-hmm.
That was it.
Yeah.
And I wanted to know, is there, was he cured?
That's a
Or-
great question. So,
Because he
yeah.
lived for quite a number of years, and he passed away from cancer, so it had nothing to do, I mean, I shouldn't say that, I'm not a doctor, but,
Yeah.
I don't think the diabetes had any connection to the cancer problem.
Yeah. So in cats, but not in dogs, there is a phenomenon called diabetic remission. And there have been many studies on it. I've myself gotten many cats into diabetic remission. If you catch the diabetes early, if you give insulin, a high protein, low carb diet, and are very aggressive with your diabetes management, up to 100% of cats in some studies can go into remission. About 40% of cats will come out of remission. What remission means is remission from the need for insulin therapy, but they are probably always going to be hovering on that brink of, diabetes is not black and white. It's I'm just sensitive enough to my insulin. I'm a little less. So we just push them back so that they're sensitive enough to their own insulin and don't need us to give them injections, but they're always hovering on the edge of that cliff, and they should always be on a high protein, low carb diet. Always. Yes. Yeah. Mm-hmm. Yeah, it's great. A great feeling when you can get a cat into remission. Dogs do not go into remission because they have type 1 diabetes.
I have a guide dog.
Yes.
And of course, because of the harness, I'm restricted in how much calories and such he can have because he'll be overweight and won't fit into the
Yes.
harness. Now the thing is, excuse me, I was told 2 cups of cereal, dry cereal, so the dog food. The thing is that one is I think it's Purina Premium, and the 2 flavors are chicken and rice and lamb and rice.
Uh-huh.
What I'm worried about is muscle mass.
Uh-huh.
Is that enough protein in those 2 cups?
Yeah, it
one in
doesn't
the
seem
morning,
like
one at night?
it doesn't seem like that much food. So the answer to the question of how much should I feed my pet, or is this enough protein? The answer is always just in looking at your pet. There's no formula that I can give you that's going to be any better than patting your dog and saying, yeah, he feels great. He's got nice muscles. So just looking at your dog, and I'm happy to pat him in a moment, but just looking at your dog, he looks great. He looks like he's in great shape. He's as shiny as can be. So I would imagine that he's getting adequate protein, but there's no formula that I can give you that's going to be any better than just, yeah, it looks like that's working terrific.
I give him treats.
Yeah.
Mother Hubbard's, that's like a milk bone.
Uh-huh.
The small ones,
Yeah.
4 of them, because of the fact they're so small so that he feels that he's getting a lot
Uh-huh.
of treats during lunch
Uh-huh.
around 12, 1 o'clock.
Yeah, I think for a Labrador, definitely they like quantity.
The
So,
other thing is apples, for him to eat.
Yes.
As a,
yes, I think apples are good. I have some pets that get an upset stomach because I think they're a little hard to digest. So if your dog tolerates the apples fine, no problem. I think a Labrador would do fine. I've had some smaller dogs that'll throw up the apple or something like that.
I went to a grocery store and unbeknownst to me, he took 3 figs.
Oh,
So that's okay, I guess.
that's fine. Avoid grapes and raisins in dogs, and other fruits are good. You're welcome. He's so beautiful.
Hi, I have a quick question. I had a geriatric dog,
Mhm.
and I gave her lots of canned dog food, but
Mhm.
then she had a tremendous problem with her teeth.
Mm-hmm.
And when they had to be removed, that was eventually what did her
Mhm.
in. If you feed a combination of dry dog food and wet dog food, is the dry hard on their kidneys?
No, not necessarily. I mean, a dry food is not going to cause kidney disease. Once they have kidney disease, we want to make sure they're as hydrated as possible. And one of the ways to do that is by switching to canned food. Our dentists generally say that all the dry food does is knock the tartar off that we can see, but it doesn't change anything about the tooth health under the gums. It just makes us feel better, like we see less tartar. So I don't know that the teeth would have been any better if he had been on a dry food. You might have seen less tartar, but there still could have been the same amount of dental disease underneath the gum.
So are we supposed to, somebody said,
Brush.
do their
You're
teeth
supposed to brush their teeth.
every week?
I don't know exactly what the dentist said, but
Okay, dental
but
health is another one.
best of luck to you.
Okay, thank
Start when they're puppies.
So long as we feed the same total amount, does it matter how often we feed our dog?
Not most of the time. Diabetics would be the exception, is that I really think they should be fed at least twice a day, probably with some treats in between. For diabetics, yeah.
So you're saying then usually once a day is
No, I
okay?
don't think it matters. I would say the vast majority of my clients feed twice a day. But when I actually used to practice overseas, and everyone fed their dogs once a day there. So I think it might just be, cultural or what have you.
Is there a special diet for a geriatric dog with a heart murmur?
So dogs with heart disease don't necessarily need special diets. The one thing that's often recommended is just restricting the sodium a little. It's not even restriction, it's just making sure that it's not a really high salt diet. And if you want, there's a really nice website at Tufts that I had mentioned. It's called the Heart Smart website, and they list the sodium content of a ton of different foods. So if you just if you search like vet nutrition Tufts Heart Smart, they have really nice, their nutritionists have made really nice lists of, foods that don't have a ton of sodium, just commercial over-the-counter type foods. Okay, I'm going to hang out for a little bit in case anybody wants to chat. Again, thank you so much. It was an absolute pleasure to speak with you.